Dr. Jia. Dr. Hu is a primary care physician, co-chair, co-founder of 19 to 0, and member of the Cleveland Clinic Canada's Medical Director Program. Dr. Hu is also currently a medical officer of health with Alberta Health Services, where he has played an important role in many aspects of the COVID-19 pandemic. Welcome, Dr. Hu.
Oh, thanks for having me.
Thank you for joining us. And you've been with us before, so I'm very excited to hear what else you have to tell us about the COVID-19 vaccine and flu. So my first question for you is, how has COVID-19 affected routine adult immunizations? Are we seeing a drop-off or an increase, or what's happening?
Yeah, so I think generally it's been negative when it comes to just pure uptake. Other than flu, we saw a bit of a bump for that last year. Right. But for everything else, when we think about shingles vaccine or pneumococcal vaccine or, HPV vaccine, there has been a decline. And a lot of that has been due to access issues. It's been, I think, public health, family doctors have really been focused on COVID. A lot of their offices have been closed. And so it's really been hard to get the vaccine. And that's not very good. But, I think on the flip side, there's certainly a lot more interest in vaccines since COVID happened. And so I think there are some opportunities that can be taken advantage of, though we really need to sort of fix some of these access issues in the short term.
So is it more than about access? Because I had originally thought maybe it's because people are scared of being over-vaccinated. And is that even a thing? Can you have too many vaccines?
Yeah, no, it's definitely more about access. We just surveyed about 10,000 Canadians, adults, kids, and basically asked the question, like, have you missed a vaccine? And if so, why? And about 70% cited access issues of various types, like couldn't get an appointment or didn't think that, my doctor would see me. And it's mostly that. I don't think there's been too much concern about getting over-vaccinated with some of these routine vaccinations. I certainly hope that none of the hesitancy and misinformation from COVID spreads into these other domains.
Right. And so when we look at routine adult immunizations, why are they critical to the prevention of infectious disease? Like, why do we need them?
Yeah, so I think that, they work. Vaccines for some of these adult conditions are not, in principle, the same as a COVID vaccine. There are lots of infectious diseases floating around still, and vaccines are really good at preventing them. For something like, pneumococcal disease, which is, spread through people contacting other people. Once we begin to get back together, as lockdowns begin to end, we're certainly going to see a resurgence of infectious disease transmission. The sort of patterns we saw last year, no flu at all, they're not going to stay because we can't sort of tolerate these lockdowns forever. For things like shingles vaccine, this is meant to prevent shingles, which anybody can get if they had chicken pox when they're younger, which is pretty much most people. But at the end of the day, we haven't seen so many of these infectious diseases because of these lockdowns, but that's going to change. And if we don't get people vaccinated, then we're just going to have more and more of these other things, right? We talk about measles as an example. Nobody likes a measles outbreak. And, everything's fallen by quite a lot, right? Upwards of, depending on the vaccine, 25 to 90%.
So I think one thing that you can probably agree with as a healthcare worker is that the COVID-19 vaccine process has been an uphill battle. So is there anything that you think we've learned from this process that we could now apply to routine adult immunizations? And is there a heightened awareness now? What are some things that we could do to make the world better?
Yeah, definitely. So, I think there's certainly a heightened awareness and interest, right? I don't think vaccines were particularly sexy as a topic before COVID. And that's probably because they were doing their jobs really well. We don't see a lot of these infections that, probably our parents or grandparents live with. Certainly a lot more awareness, but, we have to translate that awareness into access and actual uptake. And, when I think about that, through COVID, we've built certain systems that will enable all sorts of vaccination. Pharmacists, for example, have done a wonderful job administering the COVID vaccine. They do most of it. And I think pharmacists are an excellent channel to deliver other vaccines, particularly adult vaccinations. All the provinces, too, have generally had to build data systems. So, instead of tracking your vaccines in the little yellow card in Ontario, it's in a computer system. So public health has been dragged into, the 20th century, 21st century. And so these things are all things that we can build upon. And so it's mostly been bad, but I think there's a lot of tailwinds to make things better in the years to come.
That's actually a good talking point. The vaccine passport isn't just here to sort of track where you are. It's healthcare welcoming technology, which, as anyone who works in healthcare knows, is something we've been waiting for so long. So my next question is, so like I told a previous speaker, I'm not going to say how old I am, but and my age, how do I know or how do I find out what vaccines do I need for my life stage? So how does someone who is 65 or 50 or 20 know what vaccines they need so that they can ensure they're up to date?
Yeah, so I mean, there's a lot of sources you can go to. I mean, usually if you just Google adult immunization schedule Ontario or Alberta or whatever, like that's usually a really fast way to do it. And you'll be led to the ministry websites. I mean, NACI has information. You can ask your doctor, you can ask your pharmacist. But you know, it's not too complex for older adults, right? I mean, they should get a flu shot every year. They should get those pneumococcal vaccines. They should get the shingles vaccine. And for vaccines they may not have gotten when they were younger, like let's say a Hep B or a HPV vaccine. It's a lot easier for adults actually than infants, you know, who need to get vaccinated every 2 months with like 7 vaccines.
And so I want to switch gears a little bit. So our last speaker, we talked a lot about vaccine hesitancy and misinformation. And I know you've done some work to combat vaccine hesitancy in rural Alberta. So can you tell me a little bit about that and some of the things that you've done to help combat vaccine hesitancy?
Yeah, so I mean, I think when it comes to combating vaccine hesitancy, one of the biggest drivers, I think that there's some people, a very small number of people who are like kind of conspiratorial and thinking like Bill Gates with microchips in, but most people, like 95% of the population is not like that. And so in many ways, it comes down to trust, right? You know, I know a fair amount about vaccines, but even I don't know everything. And so I generally trust Health Canada. When it comes to other people, you know, if you have the trust of the community of the people you're interested in vaccinating, then that's sort of the way to go. And I think one thing that we've done a lot of has been working with different community groups, you know, in rural areas and urban areas as well, to sort of build that trust. Because oftentimes the messenger matters more than the message itself. So that's one key piece. The other thing that 19-0 has done a lot of is sort of what I'll call evidence-based marketing campaigns. And so, you know, I think that having worked in public health, worked for government, I don't think we're the best at communicating sometimes. Whereas I think, you know, a company like Coca-Cola, very good at marketing. And so we've pulled in a lot of marketing experts and, you know, fed them the data from the people of interest to build some of these campaigns that I think are hopefully a bit more compelling than sort of just say, get vaccinated.
Right. Yeah, and I think the trust and relationship piece is so important, and that sort of leads into my next question. So we've seen vaccine hesitancy and just COVID and the vaccines in general break up relationships and families, and people aren't even speaking anymore. And this is not what this should be doing. This is the time when, I mean, to sound cliche, we need to all be together. So how do you personally, or how do you recommend people combat vaccine hesitancy with people in your life so that you are still speaking to them next Tuesday?
Yeah, totally. I mean, I think it is really sad that this has happened. I mean, I generally start from the perspective that people who are getting vaccinated or aren't getting vaccinated are trying to do what's best for their own health, right? They may be a little bit misled. Like I don't tend to, you know, blame individuals for this. And so that starting point of empathy, I think, is really where you begin versus a position of judgment. And I think there's a lot of judgment from the pro-vaccine camp and also the anti-vaccine camp. But I think basically that, you know, people will only listen to you if they think you care about them. And there's been too much, I don't know, anti-rhetoric going both ways, particularly on social media. But the fact that you're talking to people means you have a relationship with them. And that's probably the single most important thing.
Great, thank you. And we have a question from our YouTube live feed. So Linda is asking, how do you deal with people who say that we won't know the long-term effects of mRNA vaccines until years from now? So why would I put this in my body if I don't know what the long-term effects are going to be?
Yeah, so I mean, these mRNA has been around for quite a long time. I could say that billions of people have gotten these vaccines. I could say that, you know, these vaccines, these type of vaccines are non-live vaccines, you know, so they can't give you a disease. And no non-live vaccine and history vaccines ever created long-term side effects. And so those are all reasons why I'm pretty sure it'll be safe in the long run.
Sorry, can I just interrupt you? Can I just interrupt you for a second? So I just want to repeat what you said. So you said no vaccines in history have ever had long-term side effects. Is that what you said?
Yeah, like non-live vaccines.
So no non-live vaccines have had. So I think that's important for people to hear because it's just important to hear.
Sure, yeah. But I mean, at the end of the day, when it comes to anything we do, getting vaccinated, any medical thing, it's always a risk-benefit calculation, right?
Right.
And if I weigh the benefits of getting vaccine, like the benefits are probably thousands, millions of times greater than the risks of it. We take risks driving to work every day, but we sort of think, oh, it's probably worth it. So I think, especially as we go into winter, where we see more cases, especially with Omicron, which is like way more infectious, the benefits just have always outweighed the risks for the COVID vaccine.
And so when we talk about misinformation, where do you recommend people go for credible information about vaccines?
Yeah, so there are so many credible sources. Any government website is going to be credible. Most mainstream, if you want something a bit less dense, like the Globe and Mail, the New York Times, they have all these explainers. Those are all very, very accurate, I think. Places to not go, I think, are Facebook groups, WhatsApp chats with your relatives, because they aren't sort of vetted at all. But there's an abundance of credible information actually out there. And so any public health website, government website, or mainstream media source, they're always generally on point.
Wonderful, thank you. And I just want to switch gears a little bit to ask you a question about pneumonia. And so why should everyone over the age of 65 get the pneumococcal polysaccharide vaccine? Why is this important?
Yeah, pneumococcal disease, this vaccine prevents against this bacteria. It can give you pneumonia, but it's also called bloodstream infections, meningitis. Every year, many Canadians die of this, and the vaccine works pretty well against it. It's available, and it's kind of easy. You just get it once generally, and then you're covered for life. And, I think that, again, we have seen a decrease in pneumonia because people have been kind of just hanging out in their basements.
Right.
But, they're going to come storming right back. And, we want to prevent as much death as possible. And for a shot, it doesn't take that long to get. It's pretty easy to get. It's free. It's a really good idea.
And my last question for you also comes from our YouTube live feed. So Anne from our YouTube live feed asks, vaccines have saved millions of lives over history. So why the hesitancy now?
Yeah, I think what sort of happened is, before COVID, there was like this vaccine hesitancy movement. But, the WHO called it, one of the great top 10 public health threats of the world. But it was much sort of smaller. And what happened, I think, with COVID vaccine is it got quite politicized, right? And, I think that fed into the broader polarization we see across society. And, that becomes, when these become political issues, they shouldn't be, it's very sciencey, you get in trouble. That being said, I still end on a happy note. Canada's first dose uptake is around 90%, which is very similar to a lot of our pediatric vaccine uptake. And so we are in one of the best positions in the world. Of course, I'd love it to be 100%, but in spite of all the hesitancy floating out there, the vast majority of Canadians have gotten the vaccine, and there's been a lot of work by pretty much everybody inside to get us there. And so, yes, it's been a problem. Yes, I don't want this to stay as a problem, but Canada as a whole has done quite well.
It's true. Well, thank you, Dr. Hu. And you're not actually going anywhere because you will be joining us again at the end of the show with Dr. Gorfinkel to go through some more COVID-19 vaccine and booster questions. So thank you for speaking to me now, and I'll see you soon.
Thanks. See you again.